As medical experts learn more about the coronavirus pandemic, we've had to adapt when it comes to communicating with our doctors about our symptoms and figuring out what precautions to take to ensure the safety of others. Dr. Tania Elliot is a telemedicine expert and associate at NYU Langone Health. Thank you so much for joining us and taking the time here today. Let's start with some of the medical headlines. The CDC adding more symptoms to the list for coronavirus, including headache and loss of taste or smell. What do these evolving symptoms say about the nature of the virus and when it comes to getting tested?
Sure. So we're still learning. My recommendation is if you have any symptom that seems out of the ordinary and it's associated with a fever, feeling under the weather, as well as a cough, you should seek medical attention. You're absolutely right. We're seeing a sudden loss of taste or smell, which we often see with viral and bacterial infections that impact both the lower and the upper airway. So we're not entirely surprised by that finding. But again, my recommendation is if you're feeling under the weather, any symptom that's abnormal for you and outside of what you would typically experience, you should seek medical attention. And again, telemedicine is your best bet. Interact with a doctor through video, say, hey, doc, this is what's going on. These are my symptoms. Make sure that we aren't dealing with some sort of atypical symptom of the coronavirus.
Doctor, there's also new information that coronavirus appears to be causing strokes for people in their 30s and 40s. So, why could this be happening?
Yeah, it's not surprising. Again, viruses don't just impact a single organ system. We can see viruses impacting multiple organ systems. And in this case, when it comes to stroke or coronatose, where we're seeing the small vessel vasculitis in the extremities, the virus is now impacting our blood vessels. And so with stroke, it's the larger blood vessels in the brain. And we've seen it with hepatitis, we've seen it with varicella. So it's not surprising. Again, this is a new coronavirus strain. So anytime you're experiencing symptoms, particularly that of headache as well, please seek medical attention.
We've also had the WHO, the World Health Organization, say that there is no evidence that people who have had coronavirus are immune. So, what are your thoughts on that?
So it's not that there's no evidence, it's just that we don't know. Again, because it's a new virus, we don't know whether or not having the infection confers immunity at a future date. So when we're talking about the importance of antibody testing, it's really just telling us, it's more of a surveillance. It's telling us who has been exposed to the virus at a given point in time. And that's important for people who are asymptomatic carriers, right? It enables us to tell whether or not there's a hot spot, but it doesn't tell us anything about the status of the immunity. That's something that's going to come in time. The only way to really know that is to take that population of patients that have been exposed, and we know they have that IgG antibody, that positive antibody that's been reactive, and then have them be re-exposed. So that's not an experiment we want to do. We don't want to re-expose people to the coronavirus, but over time, we'll be able to tell whether or not the presence of that antibody actually confers true immunity. Right now, we only know that the antibody is present. We don't know whether or not it's working to attack that virus if it hits us again.
And telemedicine is the new reality for many of us. People are not going to the doctor as often. So, what advice do you have as a telemedicine expert about this new doctor patient reality and how to not just use this as an excuse to put off appointments?
No, I mean, you shouldn't. This is a way for you to interact with your doctor. So, telemedicine is a synchronous audio video interaction between doctor and patient. So, just like you're FaceTiming with friends and family, or you're doing Skype with friends and family, imagine you're doing that also with your doctor. So, the doctor can physically see you and determine whether or not you look sick. So, in the setting of an acute illness, making sure you don't just run off to the emergency room or urgent care, but first interacting with your doctor remotely, letting them lay eyes on you through the video and walk you through some various aspects of what we call modified physical exam through telemedicine, and then help you determine the next steps. Are you sick enough where you need to go to the emergency room, or is this something that can be managed from home? In addition, if you have a chronic condition, we don't want you, if you're feeling well, to have to go and take a trip to the doctor's office where you could pick up germs. So certainly using telemedicine for those routine check-ins, if you have a chronic disease like diabetes, asthma, high blood pressure, so your doctor can check in with you, again, do those modified aspects of a physical examination through video, and then give you refills on your medications as needed.
All right, Dr. Tanya Elliott, thank you so much for your time. We look forward to getting more of your insights in the future as well.